It's been more than 10 months since the first COVID-19 case was reported in Singapore, upending life as we know it. From the first case to the first clusters and the first death, Singaporeans have watched with bated breath as the situation unfolded. Cheryl Goh takes a look back at how it all started and how some have moved on.
As news spread of more cases emerging from China, authorities in Singapore stressed that it was a matter of not if, but when the novel coronavirus would reach our shores. A multi-ministry task force was formed, and that when happened on 23rd January, just 2 days before the Chinese New Year. Singapore confirmed its first imported case, a 66-year-old Chinese national from Wuhan who had stayed at the Shangri-La Rasa Sentosa Hotel. A week later, the government handed out 4 face masks per household, with advice to wear them only when unwell. On 4th February, news of the first local human-to-human transmission gripped the country and happened right here at Yong Tai Hang, a medical hall that catered mainly to Chinese tourists. 4 cases were linked to the hall, forming the first local cluster. CNA understands Yong Tai Hang has remained shut ever since, as the bulk of its business used to come from tourists. Reality of just how severe the situation was sank in on 7th February when authorities raised the disease outbreak response system, or DORSCON level, from yellow to orange, triggering bouts of panic buying at supermarkets. The next day, Prime Minister Lee Hsien Loong addressed the nation for the first time on COVID-19. He said Singapore was better prepared to deal with the virus, having experienced SARS, and there was no need to panic.
We have stockpiled adequate supplies of masks and personal protective equipment, PPE. We have expanded and upgraded our medical facilities, including the new National Centre for Infectious Diseases. But the situation is still evolving. Every day brings new developments, and we have to respond promptly and dynamically.
In the days that followed, more clusters arose, this time affecting places of worship. The virus hit the Grace Assembly of God Church hard, with its senior pastor among its 23 infections.
At that point in time, the sentiment wasn't the most positive. It was very tough. A lot of fear, a lot of anxiety, a lot of concern. And people were wondering whether I would die, whether would I survive this. Not everybody knows about this, but half the team was actually in NCID. So it was a daily meeting that we had online, trying to navigate through this crisis.
The Grace Assembly of God became the first religious organization to officially suspend services because of COVID-19. And while the exact source of the infection was unknown, contact tracing efforts eventually drew a link between the Life Church and Missions and Grace Assembly of God clusters, with serological testing being used for the first time to uncover the link. Local cases continued to show up, notably a case at Raffles Institution that led to the entire school being shut for deep cleaning. The 12-year-old student was eventually linked to another larger cluster. In early March, a new cluster linked to a dinner function at Joy Garden restaurant here at Safra Jurong emerged. It was to become one of the largest local clusters with 47 cases, including 1 death. This cluster consisted mainly of seniors and cast a spotlight on how social gatherings could quicken the spread of the virus. Safra Jurong turned down CNA's request for an interview, but a visit there found that Joy Garden restaurant was still shut. On 21st March, the first 2 deaths were reported, a 75-year-old Singaporean woman and a 64-year-old Indonesian man. Both had underlying conditions and were warded at the National Centre for Infectious Diseases Intensive Care Unit. By the end of March, the first dormitory cluster, S11 Dorm in Punggol, appeared. This would be the first of dozens of dorm clusters to surface, with cases among migrant workers exploding to over 54,000, prompting authorities to gazette selected dorms as isolation areas.
The pandemic, 1 year on, is a CNA special report all next week. It will be simulcast on CNA TV and CNA 938 News Talk Radio at these times. There'll also be special coverage right here on Asia Tonight.